So viral dissemination. So viral dissemination is nothing but spread of this whatever the virus particles that were produced in large number that will enter into the systemic circulation by destroying the CD4 host cells. So once these were entered into systemic circulation, they not only enter into the blood, so it will gain entry into the lymphoid tissues like lymph nodes, spleen, and all the lymphoid tissues. It will gain access, and there it will be multiplied. So here the lymphoid tissues will act as a reservoir compared to the systemic circulation, that is circulation. So that we call it as viral dissemination. And then impact of HIV infection on other immune cells. So HIV, whatever the virus is there, it not only infects only few cells or like CD4 host cells. It also enters, as it entered into systemic circulation, it will spread to other body parts also and cause the destruction. So it mainly affects other cells, other immune cells, and non-infected lymphoid cells also. Then HIV infection of nervous system. So this HIV infection or HIV virus, which when entered into a nervous system, it will infect the microglial cells, astrocytes, and oligodendrocytes. So by three mechanisms, that is, first is infection carried to the microglia of the nervous system by HIV infected CD4 host cells, monocyte macrophage subpopulation, or endothelial cells. So first it will gain access into the microglial cells and cause a damage. So whatever the CD4 host cells which are having this virus, that will be transferred to these microglial cells and cause the infection. Other is direct infection of astrocytes and oligodendrocytes. So here directly this HIV virus causes the infection to astrocytes and oligodendrocytes. But in case of microglia, this HIV virus which is present in the CD4 T cells, that will be entered into these microglial cells and cause the infection. And then neurons are not invaded by HIV but are affected due to attachment of GP120. So whatever the HIV virus is there, that will not directly cause the damage to neurons, but the GP120 protein, surface protein which is present on the HIV virus is there, that will stick to these neurons and cause the damage by release of cytokines by HIV infected macrophages. So this is all about this pathophysiology of HIV virus. And now coming to history, natural history. Natural history is nothing but, so here we'll be studying like what are the different stages of HIV are there. So depending on the stages, we'll be classifying the different phases. So depending on few things, few parameters. It includes the first is period after infection. That means immediately after infection. That stage we call it as 3 to 6 weeks. Then we call it as early or acute onset of HIV. And if it is middle or chronic, it is from 10 to 12 years if the patient is alive. And final or crisis, so any age like after 12 years or 10 years up to death, that we call it as final stage of HIV. And then CDC clinical category. CDC is nothing but Centers for Disease Control. They have categorized this HIV depending on that into three different categories, A, B, and C. In the early stage, there will not be any symptoms. That is the stage immediately after infection. Here, there will not be any symptoms. So, we call it as asymptomatic infection. And acute HIV syndrome. That means here the symptoms of like acute infection kind of symptoms can be seen. And middle or chronic, it includes symptomatic disease, neither A or C, and condition is secondary to impaired CMA, that is impaired cell-mediated immunity. Okay. Here the PGL is persistent generalized lymphadenopathy. That means lymphadenopathy is nothing but increase in the size of the lymphoid tissues. Why this increase in the size will be there? Because whatever the virus is there, when it gets entered into these lymphoid tissues, then the size of these lymphoid tissues will be increased. So that is acute HIV syndrome and persistent generalized lymphadenopathy. That means there will be cell swelling in the regions of lymph nodes can be observed. In the middle or chronic stage, here the symptomatic disease, there will be symptoms, and it is secondary to impaired cell-mediated immunity. And final stage, so it is also called as it is classified as category C. Here, AIDS surveillance case definition. So like what are the like last stage will be considering as category C. And then CD4 plus T cell count. So in early stages, the CD4 plus T cell count will be greater than or equal to 500, and it will be in the middle, it will be like 200 to 499. And in the final stage, the CD4 T cell count will be decreased. Why? Because in this, during this infection, CD4 T cells will be destroyed. So the number will be decreasing as the stage is progressing. So in the final stage, that CD4 T cell will be less than 200 per microliters. So it indicates AIDS indicated T cell count. So we have to, it can be used as a diagnostic parameter in diagnosing HIV virus. And then coming to pathological lesions and clinical manifestations of HIV. Pathological lesions means, so once when this HIV virus gets entered into the systemic circulation, it causes lesions in particular organs. So wherever it has spread, there it causes certain lesions because of this viral infection. And what are the clinical manifestations? So here the formation of these pathological lesions will be taken place by will be explained by four mechanisms. So in that, first is due to viral infection directly. So because of this direct infection, whatever the immunological reaction of our body showing, because of that immunological reaction, it will be shown as a lesions. So it will be seen in the central nervous system and also in the lymph nodes. So in lymph nodes, it can be seen as persistent generalized lymphadenopathy. And then due to opportunistic infections. What do you mean by opportunistic infections? So when there is an infection with any viruses, our body's immune system will be compromised. So taking that as an opportunity, other infections will be taking place. That we call it as opportunistic infections. So those who are having HIV, they are at risk of getting many other infections. So because of this deteriorating immune system, our body will become as an opportunity room for many of the microorganisms causing opportunistic infections. So mostly you can see this TB. In the last stages, almost all the patients of HIV will be having tuberculosis. And then due to secondary tumors like end stage of HIV or AIDS is characterized by development of certain secondary malignant tumors. And then due to drug treatment, so which were the drugs that were used in the treatment of this HIV? They also produce some kind of toxic effects. So that include aggressive treatment of, so these include antiretroviral treatment, antiretroviral, RVD and HIV is also called as RVD, that is retroviral disease. So for that, what are the antivirals that we are giving? That may cause some toxic effects. And for opportunistic infections, we will be giving aggressive treatment of antibiotics. So on using large doses of those antibiotics, they also cause certain drug toxicity. And also some tumors which are formed in the secondary stage, secondary malignant tumors which are formed, they also cause the lesions. So these are the four different mechanisms of how pathological lesions were formed. Then coming to clinical manifestations, and so major clinical manifestations that we can see include wasting syndrome. That means sudden loss of body weight can be seen. That we call it as wasting syndrome. Persistent generalized lymphadenopathy. That means whatever the lymphoid tissues are there, there will be persistent adenopathy. Like that means there will be increase in the lymph nodes can be seen. And GI manifestations like nausea, vomiting, and diarrhea also can be seen. Pulmonary manifestations, like if there is any lesions formed in the pulmonary region, it causes pulmonary manifestations. Mucocutaneous manifestations, that means formation of like small lesions all over the body, and the nasal region and the lips region, that kind of lesions can be seen. Hematological manifestations, CNS manifestations, gynecological manifestations. So all the systems will be included. So all the systems will be included. All the systems will be affected. And then secondary opportunistic infections, as I said that as in case of HIV, as our body's immune system is compromised, it will become it will invite only infections. So because of that, there will be more number of other infections will be taking place. It include fungal infections like candidiasis, cryptococcosis, coccidioidomycosis, histoplasmosis, nocardia, and viral infections, other viral infections like cytomegalovirus, herpes simplex, herpes zoster, Epstein-Barr virus, that is EBV, HPV, and HPV is nothing but human papilloma virus, so which causes cervical cancer. And then bacterial infections like mycobacteriosis, Especially we can see this Mycobacterium tuberculosis is in almost like 50, more than 50% of the patients with HIV will be having this tuberculosis. And protozoal and helminthic infections like pneumocystitis, toxoplasmosis, giardiasis, amoebiasis, cryptosporioidosis, strongyloidosis. So all these opportunistic infections will be taking place. And then formation of secondary neoplasms, that is secondary malignant tumors, secondary tumors formation also can be seen. It include Kaposi sarcoma, primary CNS lymphoma, Hawkins lymphoma, HPV associated carcinoma, that is, as I said, that we can see this in cervical cancer. So in cervical cancer, the etiological agent is HPV virus that we have seen in secondary opportunistic infections. So because of that, again, there is a chance of this getting these neoplasms and bacillary angiomatosis. So these are the different neoplasms. And the neurological diseases include AIDS dementia complex. That means those people who are having AIDS, they will be having dementia. Dementia is nothing but memory loss. And meningoencephalitis, meninges means these are the meninges. Brain will be having different meninges. So due to that meninges, there will be infections that we call infection with certain bacteria like tuberculosis and cryptococcal infections. So because of that, there will be meningoencephalitis can be seen, aseptic meningitis, peripheral neuropathy, demyelinating lesions of the spinal cord. In the neuron, you can see this myelin sheath. So because of these infections, what will happen? Whatever the neurons are there for that, this myelin sheath will be eliminated. That will be damaged, causing demyelinating lesions of the spinal cord and lymphoma of the brain. So these are the neurological diseases that we can see in case of HIV patients. And then coming to, so this is all about the clinical manifestations of HIV or AIDS. And now diagnosis. So what are different diagnostic tests are there? So as it is a virus, as it is an antigen, we have to identify the antibodies. If the antibody is present in our body, it indicates that antigen is there, right? So the antibody tests include ELISA and Western blotting test and direct detection of HIV, that is direct detection of antigen, HIV antigen. It includes P24 antigen capture assay, HIV RNA assay, DNA PCR, culture of HIV. So P24 is a core protein, so we'll be identifying this protein. If this protein was found, it will indicate the presence of HIV virus. And HIV RNA, as in the core, there will be presence of 2 single-stranded RNA. So identifying that, DNA PCR and culture of HIV. So cultural sensitivity also will be done for HIV. So these are the tests for identifying the HIV infection. And then test for defects in immunity. So what are the defects in immunity? So CD4 T cells, CD8 T cells, so these are the immune cells. So there will be defects in T cells, that include there will be decrease in the count of CD4 T cell count. As we have seen that in the last stage, there will be very much decrease, that is less than 200 of this can be seen. So decrease in the count, and CD8 plus cell count will be increased. Why? Because these will suppress the immune system. So that will be increased, and ratio of CD4 plus T cells and CD8 T cells count will be reversed. That means there will be decrease in the CD4 and increase in the CD8 cells can be seen. And lymphopenia, because all the lymphocytes were damaged, so that there will be decrease in the lymphocytes count. That we call it as lymphopenia. Penia means decreased. Lymphopenia means decrease in the lymphocyte count can be seen. And hyper gamma globulinemia, that means because of this breaking down of these protein molecules, gamma globulins will be increased in the systemic circulations, which were the metabolites of these proteins, and increased beta 2 microglobulin level and platelet count. Here thrombocytopenia can be seen. That means destruction of platelets also will be seen in case of, which will indicate the defects in immunity. And then test for detection of opportunistic infections and secondary tumors. So for that, we'll be going for FNAC and biopsy. So here in FNAC and biopsy, we'll be collecting a small tissue from the lesions which were formed in this HIV. That the small tissue from the lesion will be sent for the cultural study in order to identify whether there is any opportunistic infection is there or whether there is any tumor that can be identified with the help of FNAC and biopsy. So these are the diagnostic tests of HIV or AIDS. So this is all about HIV, and thank you all.